am a person who believes very strongly that people deserve information. 100 years ago in medicine, it was very different how we did things. You just sort of, as a physician, you just sort of did what you thought was right for the patient. There wasn't a conversation. There was not informed consent. All of these differences that are quite dramatically different nowadays, and appropriately so in my mind. And I felt that there were certain situations where families were not being told information that they would potentially find helpful. And I think that was for various reasons. And one of them includes the concern that as soon as you start offering things to people, particularly parents who desperately want to do the right thing for their children in almost every single case, are we passing on the responsibility of decision making? Are we abdicating our duty, giving up our responsibility as a physician, as a medical provider, and putting that on parents by giving them too much information, too many options that we don't think is right, based on, in my opinion, old data that really is not supported any longer, that, there is futility in providing surgical interventions, breathing tubes, new IV nutrition, all these different things that, we can kind of talk about the nuances of that if we'd like. But for a very long time, it was just, we were all taught, and I still remember in medical school and being told that these are lethal conditions. And then I came into fellowship, and lo and behold, that's not actually true. And that transition is very hard, but that if we intervene, some of these patients are able to survive. As you said, Dr. Carey, a significant portion, despite what we do and our best efforts and our best interventions, are not able to survive. But there is a portion of these children who have that potential. And so we have these providers who have to come to the recognition in their own mind that while they were doing their best, they're good physicians, caring, thoughtful, up to date on the literature, they let babies die who maybe didn't need to. And that's really hard. I think that's part of why this transition has been challenging, among other reasons. Just the sort of cognitive dissonance of that understanding that what you used to do was potentially wrong. And that's hard for people.